So again, welcome everybody to this informational session on the Victor pilot study, and then Virta Health has graciously agreed to just share the process, what a participant, what a person can expect when they get in the Virta system. We're really excited about the study and working with Virta, so I hope you guys are excited as well. Okay. So it's a long acronym, and so you can kind of read what the Victor study stands for there. Virta intervention in communities in Colorado, specifically rural communities. So we're excited to be in rural communities. Okay, so what is this study trying to do? So we're really looking at Colorado Heart Healthy Solutions. So that's the program that Bev and Holly work on. And if you're a potential participant, you should know those are our health navigators, we call them in the field. And Colorado Heart Healthy Solutions it's just a lifestyle intervention program. And then we're testing when Holly and Bev refer on to a nutritional virtual lifestyle intervention, Virta, for type 2 diabetics. We just see what that does, and we're going to look at the results, and we're really excited about working with Virta. And hopefully the study will inform the acceptability of that referral, the retention of participants in Virta, and then the durability of the effects. So, after Virta ends, do people keep the weight off? Do they keep their A1C down, and so on? And then just some benefits we wanted to share too. The Virta treatment has just, and I know Dr. Volk will go over this too, it's just been studied pretty extensively, and just the results are spectacular. CHHS also, the program that Holly and Bev work on, has had some excellent improvements in a lot of the different heart health markers and diabetic markers as well. And then we just want to add to the research about, especially in rural communities, we feel like we want to really represent the rural communities that we serve. So we're excited about that as well. And with that, I will stop sharing and let Dr. Volk present.
All right, just give me a second here and I will get all caught up. I see more people are entering the room. So that's great. Very excited. And I think, Nick, you said we're going to save questions to the end.
Correct. Yes.
Okay. Awesome. I am a fast talker. I do have a lot of slides to get through. So hopefully we'll have plenty of time at the end. So I'm really excited to be here because I haven't had a lot of interaction yet with the awesome team at CPC. But what I do is things like this a lot of times, where I do educate our patients on the Virta treatment. So I'm really excited the opportunity to share specifically, with this study, how we'll be doing our traditional thing with Virta, and then also working with you all. So here's our agenda for the day, and then I'll introduce myself. I'm going to talk about Virta's diabetes reversal. I think the term for many people is a little bit new, so I want to explain that. We'll talk about how and why Virta works, so really talking about the science of our treatment. I will walk through step by step the patient experience, what it looks like for you, what it looks like for the rest of our Virta population, which is just a very similar experience. And then if you're interested, how to then enroll in Victor, and I would welcome, Nick to, of course, chime in, and then we'll save the Q&A for the end. So a little bit about myself. I am a clinical research scientist. My teammate Brandon here is also on the call. We are founded, Nick referred to this, that we are founded in science. So data for us is so important, and our treatment is evidence-based, as I will explain here with you today. So that's first and foremost, one of the biggest reasons why our approach works is because we have the science-based nutrition recommendations. I am a registered dietitian, so I love nutrition. I love researching nutrition. And then the thing I love the most is the translational component. So putting it into practice and getting it into the hands of people who can benefit from it. So all of you hopefully on this call here today. Without further ado, we've got a lot to get through. So I'm going to explain more about Virta and our diabetes reversal treatment. So Virta has the first and only medical treatment that is proven to reverse type 2 diabetes. And when I say that someone has reversed their diabetes, how we define it at Virta is they have to meet two criteria. So this is important: getting off of all diabetes specific medications and controlling their blood sugar down to below those diabetic thresholds without the need of those medications. So getting healthier, getting better blood sugars without the medications, but we do so through a nutrition and lifestyle intervention. So we do what we call de-prescribe medications to help patients get healthier. Our mission is quite lofty. So we're on a mission to reverse diabetes in a lot of people by 2025, and we're really well on our way to doing so. Now, I mentioned that science and being evidence-based is very important to us. So the first thing that we did as a company was conduct a clinical trial. And this clinical trial is now the largest and longest clinical trial in low carbohydrate nutrition and diabetes reversal. We just completed 5 years of our study. Now, it takes a while to publish all of this information, but some really awesome statistics to just look at to show you this treatment works. And again, we published this in peer-reviewed literature to say this really does work. We wanted to share that with everyone. So 60% of our completing patients at just 1 year reverse their diabetes. So they don't need medications to control their blood sugars to below the diabetic threshold. And that's measured by a hemoglobin A1C, which is an average of 3 months of blood sugar control. So you can see on average, people saw 1.3 percentage drops. They saw 94% of insulin users reduced or eliminated their insulin. And then a really nice side effect to our treatment, just to kind of, hook you into some of what our patients are seeing, is that they see on average at 1 year, 12% weight loss, about 30 pounds. And then we see this, sustained out to 2 years. And the benefits when we focus on blood sugar control, again, through nutrition, and I will go into detail there, patients see these other benefits. And these are just some of the benefits. These are what we have also published in the peer-reviewed literature saying, hey, this really does work. So one of the things that I will point out here, in addition to all of our publications, again, we on the research team do like to not brag about these, but really show this off because we work hard to demonstrate our outcomes. The American Diabetes Association has actually recognized a low carbohydrate approach to control blood sugar in those with type 2 diabetes. And so this was first recognized in 2019, again in 2020, and again in 2021, citing our research as part of coming to that conclusion that, hey, a low carb approach, and I'll give you much more detail about that, but it really does work in controlling blood sugar. Now it works, and I showed you that it works, in 60% of our completing patients at a year were able to achieve these results. By the way, the other 40%, they're still working on it. Each person that enters into our treatment, whether they're in our clinical trial or they're in one of our other groups, they all have their own journey. And that's what this slide really represents, is that we, even on this call, are all so unique. So we really do personalize the treatment to each and every person, because we all have different dietary preferences. We have different schedules. I mean, I'm over here on the East Coast. Many of you are out there in Colorado on mountain time. So we live different lives, and we get that. So we personalize it here at Virta. So it's not just about a statistic of what kind of results our patients see. But when I think about all the people that walk through our doors, I think a lot of people, including one of our patients, Lori here, we love highlighting our patients. Lori, when she walked through our doors, didn't know that diabetes reversal was even possible, because for the most part, we talk about trying to prevent the disease. And then once we get it, it's controlled through, we try diet and exercise, but if and when that fails, which typically it does, we usually throw more medications at the problem. And at Virta, we want to really reverse that and get you off the medications, controlling blood sugars, simply by changing what you eat. Now, at a very high level, there are 2 things I can think of that make Virta what it is, and then I'll walk through step by step in a lot of detail. But first, we have the science of our nutrition approach. So we call this Virta Reverse, and it is based on carbohydrate restriction. So things like breads, rice, pastas, cereals. It's based on the research of our scientific co-founders and of course many others, and then how we deliver that care. So I think, healthcare can be really hard, really confusing, overwhelming. What we do is we deliver our treatment through technology. So we have what we call Virta Continuous Remote Care, where we have a team of licensed Virta physicians and health coaches dedicated to you. Literally someone you can reach out to, ask questions, is also going to be proactively reaching out to you and looking over your health and your progress to get you to that point of diabetes reversal. But again, I have to stress this, and you'll hear this word probably 10 more times in my presentation. It's personalized and highly individualized. We'll give you some basic nutrition guidance, and we will, trust me, we will provide you with all that education. But we want to tailor it based on the foods that you like and helping you understand how you can not only implement this lifestyle, but also then learn to really make these habits to become this lasting change for a lifetime, because we want to get you to better health for a lifetime. Some of the key tenets here, it's based on real whole foods that you enjoy. So we're not going to push a meal plan on you and tell you eat this, right? Because who's going to follow that? You're not going to achieve better health if it's something that you don't want to and can't stick to. So it's not pushing bars or shakes. You get to eat until you're satisfied, not restricting calories or walking around hungry all day long. And while, exercise can be great for a lot of things, it's not actually required in order to really fix your metabolism and help you to get that blood sugar control. So we're focused on your nutrition, not the exercise, though we will support those who want to exercise. But we're not saying, all right, here we go, change your nutrition and go out and exercise. So diving even deeper into the how and the why, that was kind of just a high level. At the very foundation, type 2 diabetes and related conditions like prediabetes are essentially diseases of high blood sugar. And I mentioned that threshold of diabetes, that A1C of 6.5 or higher. That means when you hit that point, you have hit that diabetes threshold, right? And there's really a few approaches of how we can try to get blood sugars under better control. The goal is to lower your blood sugar into first pre-diabetic ranges and then that normal range. So if we want to do this, typically in healthcare, what we do is we do it through medications, or we do it through saying, let's diet and exercise. And usually that involves calorie restriction. So that's sort of the standard approach to diabetes care. At Virta, we do something different where we want to directly reduce blood sugars, again, by controlling what you eat. Now, a core of our nutrition, I mentioned it several times, is carbohydrate restriction. We all have a level of carbohydrates that we can tolerate. And if we have type 2 diabetes, we can think of it as a carbohydrate intolerance. So we can't tolerate as many carbs as maybe someone who does not have type 2 diabetes. So at Virta, we help you to reduce your carbs below that limit that you have, and then consume enough protein to meet your body's needs. And we educate you on all of these different sources and we walk you through it. We give you sample meal plans. And again, we give you a coach to help you through all of this as well. And then you consume fat, things like butter and olive oil to satiety. That's where you're not hungry. You're not, thinking about your next meal as soon as you finish your first meal, right? So these are kind of the core principles because we really do use food as medicine. When done right, and when you put the right foods together, it can actually be more powerful than some medications. So when we think about, if you're probably familiar with the food pyramid that's put out by our US government, typically you see something different than what I'm showing you here. So typically we're told to consume most of our calories coming from carbohydrates, things like whole grains, right? Breads, the rice, the pastas, even the fruits. But we actually change that here because carbohydrates get broken down into sugar when you eat them. So even when you eat something like an apple, it's actually loaded with sugar. And in turn, as we break down that apple, it raises our blood sugar. So carbohydrates are the food group that raises our blood sugar the most. So when I say we use science-based nutrition here at Virta, we're limiting those sources that are going to increase your blood sugar, and we're swapping them out. So we actually recommend that fat becomes your primary fuel source, because when it does, you actually start to use that fat for energy and burn your own body fat. So this is a really important point. And then, you'll get some carbohydrates through non-starchy vegetables, a little bit of dairy, and maybe some berry fruits. But, again, we'll guide you to the right nutrition for you, but limiting those carbohydrates and swapping out to use fat as your primary fuel source. So the pyramid looks a little bit different when you're restricting your carbohydrates on Virta. Now, if we go back to that one image I showed you where I said, okay, there's our science-based nutrition, and then there's the technology and how we deliver it. That's basically that slide, but in more detail here. So let me introduce you to Wilma, who happens to be at the center of this slide on purpose. And I think Brandon can attest to this, where we put the patient at the center of everything we do. Our communication, how we built our app, everything we do, the patient is at the center. I think you can attest to this, that, Wilma, again, she's a real patient of ours. She came to us having gotten so much advice relating to her diabetes care. She saw a dietitian. I'm a dietitian. I can say that. She was confused by the nutrition advice. She saw her doctor, and she was constantly getting more medications thrown at her, despite her best efforts to control her blood sugars and doing everything she was told to do. So what we do when a patient enters Virta is we educate them on the why, the how. We give them a care team to be able to support them and answer any questions they may have, to also look out for their safety. And their physician is going to de-prescribe or take them off of those diabetes medications as their blood sugar gets better. Now, the key to how we know when this is that Wilma is monitoring her biomarkers. These are things like her blood sugar, something we call ketones, her blood pressure, and then we're also tracking her body weight. So understanding how her body is responding to the treatment. And based on these numbers, that's how we, her care team, know how to reach out with the right nutrition recommendations and how to safely de-prescribe those medications, which is our goal at the end of the day. Get that blood sugar under control without the need for medications. Still, that was kind of a high level. I'm going to walk you through what it is exactly like to be a patient here with us at Virta. So here's Wilma again, came to us like many patients on a number of diabetes medications. Her A1C was above that 6.5 diabetes threshold, and she weighed nearly 200 pounds. Now, for those interested, your health navigator is going to help you fill out a basic form of information. At the end of this form, you and your health navigator are going to schedule a call with one of our dedicated enrollment advisors. I said that healthcare can be confusing and overwhelming, and we want to take away some of that confusion and make it as easy as possible. And we do that by providing you a single point of contact, a person at Virta that you can literally talk to on the phone. And we make sure that we walk you through a little bit more detail of the treatment and any questions that you may have as they relate to you. Of course, this is a brief info session, not going to be able to answer personalized questions. Your enrollment advisor can. And by the way, after that intake call, you actually also can pick up the phone and call them back and ask them questions. You can email them. Again, we really want to make sure that you have all the information you need and want before making a decision if Virta is the right treatment for you. So after that call, the next thing you're going to do is you're going to get in your email a health history form. This is a really important form to fill out some information before you get to this last step in the enrollment process, which is meeting with your Virta physician. This is going to be like a doctor's visit, except it's done through your computer or through a smartphone. So it is a telemedicine visit where your doctor will then approve you for the treatment. Now, one thing I will note is that You will likely not need to go get labs done. Your health navigator is going to work on getting those labs that you've already had collected, unless someone from Virta or your health navigator says, actually, you do need to go get labs, but otherwise you won't need to go get labs drawn for enrollment into the study. Now, after this step, you're going to receive in the mail, once approved for the study, you will receive a starter kit. This is going to contain all the tools that you need that I mentioned. We're going to be monitoring your numbers, right? This is how you're going to measure them. One thing I'll point out is you get, in addition to the scale and a number of other items, you're going to get a meter that will measure both glucose and ketones through a simple finger stick test. And we'll also make sure that you are fully stocked with the strips in order to actually test those values. So we'll send those strips on an ongoing basis to make sure that you are always supplied with what you need to monitor your progress. You also meet your health coach. You actually get to work with a team of coaches. These people are, I cannot tell you how much they are there for you almost around the clock. Now, you're human, so they do need to sleep, but your health coach is going to be available on the front lines, answering questions, checking in on you to see how you're doing. You name it, that person is going to be there for you. You can literally reach out to them through your smartphone, also through the computer, and chat with them, text them a question just like you would, a friend, to then also get real-time support when and where you need it. Now, before getting started, we're going to ask you to go through a series of educational content, including videos and guides and infographics, because we want to make sure you're prepared to make the nutrition changes when it is time to do so. Stocking your kitchen, understanding the why behind the treatment, really the science, so that you feel empowered to make the changes that you're making and not just saying, because my doctor or my coach told me to do so. You are really going to learn about the why. You'll also have a personalized care plan available to you through the app, guiding you through what to do, when to do it, how often to measure your blood sugar, what, educational videos are available to you, you name it. This is all going to be available through the app and your personalized care plan. Everything you need is available to you in the app. When you do start to make those dietary changes, as I mentioned, you're going to be entering those biomarkers into the app where your care team, your coach, and your Virta physician get those numbers in real time. We get the numbers, what they are today, so your blood sugar, we get what they were yesterday, and every single day since you started the treatment. Wilma's actually been with us since 2016, so we have quite the record on Wilma, which helps us really understand trends in her biomarkers, right? Maybe some seasonal changes. But the important thing that I'll highlight here, and I'm watching time, is that we are going to be able to de-prescribe the medications when it's time to do so. Wilma started out on insulin, which can dramatically reduce her blood sugar. If her blood sugar begins to reduce based on her nutrition changes, reducing those carbohydrate intake, our system picks up on that change and tells her doctor here, Dr. Roberts, it's time to reduce her dose of insulin so that we avoid her blood sugar going too low, which can lead to some pretty dangerous situations here. So we let Wilma know of her change in medications, and then we also communicate with her existing physicians, because we get it. Wilma's been working with her doctor for years, but we're now taking on her day-to-day diabetes care, so she and her primary care provider can focus on other health concerns. We will send progress reports to her physician on an ongoing basis so that we close that communication gap and make sure that the patient still remains at that center of care. Another feature that I like to highlight here, when it comes to communication and connection and support, is the online patient community that patients can join to connect with other patients around the country about their Virta journey. If they're looking for support, if they are struggling through something, right? Because we're human and it's not always a perfect journey. You may find yourself struggling at times, or you're looking for a new recipe. You name it, you can connect with patients around the country. So some reasons, very briefly, why Virta works is that we provide medical care almost around the clock, like I said. And so when and where you need us, being out in a rural community, maybe it can be a little bit hard to connect with your doctor to make that appointment. We take on that diabetes care and we're available to you through the app. You know, our nutrition recommendations are based on science, but we personalize your healthcare and your treatment for you. And we just provide that support as often as you need it. And we're also committed, I have to say this because Brandon and I are on the call, we're committed to continue the research, which is why we're doing this study in the first place, to further improve our treatment and make it available to those who really need it. So if you are interested, you know, I know that you'll be going through an informed consent process. This is just sort of an information gathering session. You'll do that application form. There's no obligation in filling out that basic information form with your health navigator. You'll schedule a call with an enrollment advisor. You'll learn more about Virta and things specific to your treatment. You likely will not need to get labs done unless otherwise told to do so. And then make sure you fill out that health history form that you get in your email before then your last step, which is the clinical intake call with one of our Virta physicians. So 5 or so minutes for questions. I'll let Nick, if you want to kind of take it away, open up the floor.
Absolutely. Thank you so much, Dr. Volk. That was awesome. All right. I'll open it up to questions. Who has questions?
I can tell you a question I get a lot if there are no questions. Let's see, relating to our nutrition advice, a lot of times I get, oh my goodness, if we're eating all this fat, what's going to happen to my triglycerides and my cholesterol? Well, what happens is when you consume carbohydrates below the amount that your body can process, so you really keep your carbs in check, like I mentioned, your body begins to burn that fat as energy. And we keep an eye on this. This is why we do follow-up labs. So most patients in our study, and we look at cholesterol, their good cholesterol, which is actually really hard to budge, goes up. Their LDL cholesterol either stays the same, some go up, some go down. It really is a little bit more inconsistent, I will say. And then their triglycerides like plummet. So that's a really good improvement. And overall, our patients see a big improvement in cardiovascular disease risk factors. So at 1 year, we see a 12% improvement in what's called a cardiovascular disease risk factor score. So we're keeping an eye on our patients. They do really well. They're burning that fat for fuel when they restrict those carbohydrates.
Perfect. Last call for questions. Anybody with specific questions about the study or Virta?
And remember, you're gonna, oh, there's a question.
Just say it. Why is my blood sugar so high in the morning?
Oh boy. So one of the reasons it may be so high in the morning is called a dawn phenomenon. You know, your body is producing sugar overnight. And so there are a number of hormonal influences there, one of which is our stress hormone called cortisol, which basically, I mean, one of the things that it does is in the morning, it wakes us up, it prepares us for the day. But in doing so, it also causes our blood sugar to rise a little bit. And we troubleshoot this with our patients because even when you restrict carbohydrates and you see better blood sugar overall, you still might be getting a little bit of that higher blood sugar in the morning. And it's really funny when patients begin to get tightly controlled blood sugars, that little rise in the morning, even if it's better than it was before, they start to become hypersensitive to trying to control blood sugar as tightly as possible. So again, we'll troubleshoot with you. There are a number of things that we can work on together to try to get it as good as we can get it in the morning and all times of day.
Since I started using insulin, I've gained weight and my belly has gotten bigger. What is causing that?
Great question. So one of the things is insulin is important, right? So insulin, we release insulin when our blood sugar rises. So our body releases insulin from the pancreas. Say we eat a slice of bread, our blood sugar goes up, our body releases insulin to try to bring that blood sugar back down. When that system is no longer functioning properly, that's when we rely on the insulin shots, right? To try to reduce our blood sugars. Insulin's important, but one of the things that we often aren't told is that insulin's also our fat storage hormone. So it's actually signaling our body to store the fat that we have and to store the carbohydrates that we're consuming, especially if in excess, as fat. So we're kind of making new fat as well. And so that is why we often will see weight gain when patients are taking insulin, and we throw more insulin at the problem as blood sugars creep up over time, again, causing more and more weight gain, which is why we do see when we control those blood sugars that insulin or that weight loss is like that side benefit we start to see when blood sugars are controlled. We're not needing the same amount of insulin anymore. We're even able to get a lot of our patients off of the insulin that they're taking. So that's one of our goals, to help patients also lose weight. The blood sugar is our main focus.
Great questions. Yeah, thank you very much. Yeah, you can tell. Yeah, you can tell Virta knows what they're talking about. Definitely.
Well, and I really appreciate the questions. And this is exactly what, as you think of, because if you're like me, you get off these kind of webinars and you're like, oh my gosh, I thought of 15 more questions I wish I would have asked. Your enrollment advisor is going to be able to answer those questions for you. So, please don't hesitate to go through this process with your health navigator, and we'll make sure that your questions get answered.
Yep, and I'm just going to put contact information up. So if you're in Lamar or that area, Holly Burton is your contact there over at High Plains. And then if you're in the Chaffee County area, Bev Oral is also there. And I put Anna Tribble, so at CPC, that's we're part of the study as well, and my number as well. So if you have any questions, I think your main point of contact would be your health navigator, first and foremost. So. But thank you so much.
Question.
Oh, okay, go ahead.
Too late.
Sorry. Nope.
What is metformin? I'm taking metformin and I don't know what it is. I don't understand it.
So metformin is an oral medication that can help to control your high blood sugar, and it's actually used in patients not only with type 2 diabetes, but with pre-diabetes and some other indications. So there's a lot more detail in terms of what it is, but it's typically one of the first diabetes medications that a patient will start on. And again, sometimes even preventative before you get to the point of developing type 2 diabetes.
Thank you.
Great. Again, thank you so much, Dr. Volk, for jumping on and just going through the process. And it was excellent presentation. And I think hopefully we'll have this link as well. And so if anybody would like the link, we'll make that available. And so I will send that out to both Bev and Holly. So they'd be my main point of contact for that if you want to revisit this presentation. But with that, I kind of wanted to end it at about 30 minutes. Again, thank you so much, Dr. Volk. Appreciate it.
Awesome. Thank you, CPC team, and all of you out there. And I do hope to see you, on the other side at Virta. So thanks for your interest.
Perfect. Thank you, everyone.
Thank you.
It's interesting.
I finally got the Zoom to come up on here.